Hi, Mrs. Palmer. Pleasure to have you this evening discussing your mystery vitamin. Um, I know you're more than qualified to do this, board certified nurse practitioner, um, that you also are into functional medicine and alternative medicine. You have your own company, you're director of Mahanaim Wellness. Um, and you have been helping a number of women to overcome these various female challenges, using natural approaches and alternative approaches and so on, in addition to your normal job, right, in allergy medicine. So you're more than qualified. So this evening we're going to look at the benefits of this mystery uh, vitamin that you mentioned, and for adventure, I may learn something, and our listening audience or viewing audience may be benefited also. And so, without further ado.
Thank you for having me, Anthony. Yes, I did entitle this evening's presentation as the mystery vitamin that could save your life. All right, and I am going to share my screen. All right, so this mystery vitamin helps with a number of stuff. It has benefits, the beneficial effects on inflammation, cardiovascular disease, cancer, Alzheimer's, diabetes, peripheral neuropathy, dental health, kidney disease, and a bunch of other stuff. Quite, I don't think this is an exhaustive list, but just so you know what is entailed here. So when we look at inflammation, right, one of the things that is, as I always say when we discuss the whole aspect of illness, is that for me, from my standpoint, inflammation tends to be the major the underpinning of most diseases, right? This mystery vitamin cuts down on pro-inflammatory markers. And so
what is inflammation? Could you elaborate just a tad?
So inflammation is, our immune system is built to protect us.
Okay.
And it uses a series of pathways that it activates whenever an invader or virus, such as virus or bacteria or whatever enters our body. This immune system inside certain chemicals that we call cytokines. And many of us heard about this during COVID, cytokine storm.
Cytokine storm. Yeah.
Yes. So the immune system is actually trying to protect us, but in so doing, it causes a lot of collateral damage. So inflammatory markers, most of which have names. And in this case, I listed just two, interleukin-1 and tumor necrosis factor. These are some pro-inflammatory cytokines that this mystery vitamin helps to suppress. So in an essence, it deals with inflammation. As it relates to cardiovascular disease, it also prevents, this vitamin prevents the hardening of the arteries, as is noted in arteriosclerosis, wherein this plaque is deposited into the veins, and it makes the veins become hardened, or what we call non-compliant, non-distant on the veins, right?
So in my layman term, I can say stretchiness or the ability to expand, right?
That's right.
Okay.
So the vein is supposed to be compliant, dependent based on the pressure from the heart.
Yeah.
So if if pressure increases, the vein should increase, the vein size should increase to accommodate that. If pressure decreases, it should decrease as well. But we find out that people who suffer from arteriosclerosis don't have that sensibility. Likewise, blood pressure, high blood pressure. So the blood pressure goes up. So we find that this vitamin helps in lowering both your diastolic and systolic blood pressure.
What are those again?
Well, the diastolic blood pressure is, to put it simply, is just the heart resting, and it's the pressure that is on the arteries
Okay.
when the heart rests. And the systolic blood pressure is the one above. So diastolic, when you get your blood pressure reading, there are two.
Oh, yes, I remember.
Right. So the systolic is on the top. That's the pumping action of the heart, the pressure that is exerted on the blood vessels.
So you're saying if the blood vessels are not, in my layman term, as flexible as they should, it gives the heart more pressure to actually pump that blood through that
Exactly.
minimize diameter of the
lumen of the blood vessel. Right.
Lumen.
Right.
Okay.
So that round circle like this
becomes smaller.
Right, because the plaque builds up around here, and so the pressure
I got
increases.
you.
So this mystery vitamin, Mr. Palmer, it helps to take care of that calcification in the arteries. Likewise, as I was saying before, I don't know if did I touch on the whole aspect of the studies that brought this about?
No, not yet.
Oh, okay. So I think I'll
elaborate on that later on.
Right.
Okay.
But sufficing to say, this vitamin helps reduce cardiovascular disease by about 90%.
Wow. That's
according to studies.
Interesting.
Yeah.
What other disease does it help with?
So like I showed the list earlier, it also helps with diabetes, right?
That's a big one.
Right. And one of the ways it helps is to make a person more sensitive to insulin,
Nice.
and it decreases insulin resistance. So it's pretty good.
Okay. Could you elaborate a little bit more on insulin resistance? What's exactly that?
So insulin resistance is insulin's job is to open the cells. Let's just picture the cells, or especially our muscle cells that picture it like a lock and key. Insulin's job is to open the lock so that the sugar that we digest from our food can go into our cells to give us energy.
I see.
So when someone has high blood pressure, not high blood pressure, high blood sugar, that sugar builds up in the blood and is not able to go into the cells. So in a way, various mechanisms are set in place to cause this, which I can't go into given this presentation.
But I got it. Basically, it's the willingness of the cell to accommodate the actual key, which is the insulin.
Right.
Which shuttles sugar
into the cell, so you have energy. Right.
Interesting.
So the other aspect of insulin resistance is insulin sensitivity. So the one, it's not responding to insulin, and the other, it becomes more responsive to insulin.
I see. Will you elaborate any further on other conditions that this may be helpful?
So studies have shown that this mystery vitamin is beneficial in a number of cancers, like leukemia, cancer of the liver, cancer of the lung, the ovaries, even prostate cancer. It reduces the risk by 30 to 35%, if my memory serves me.
Is this being used to treat these conditions?
No, but
why not?
Well, because of the nature of this program, this presentation, I can't go into all of that. But sufficing to say, this presentation that I'm doing is not a substitute for, I'm not purporting to give anyone advice to override that of their prime. Although I'm a medical provider, I'm not saying they should override their primary care providers, but it's good to know that you have this particular vitamin that I'm going to speak about. I will reveal at least later on in your arsenal that you use it, because way back in the days, a couple of years back, I should say, this vitamin was found to have a good link between, like I said before, cardiovascular disease and this vitamin.
Any other conditions? Is it? Okay.
So apart from cancer, we also see it is impacting Alzheimer's.
Yes. It's a big one also.
Yes, definitely, because about 6.2 million people currently in the United States are suffering from Alzheimer's. And
I remember my mother before she passed. I think she was becoming. Yeah.
She had some type of dementia.
Dementia.
Right. So what happens is that this okay, so Alzheimer's they find because of the amyloid plaque that's deposited in the brain. This vitamin helps to cut down on what we call neuroinflammation.
Okay.
Neuro has to do with the nerves. So when the nerves become inflamed, stuff happens in our brain. And so this vitamin helps to cut down that inflammation, as I mentioned earlier. Another one.
Really an interesting vitamin.
Yes, indeed.
Yeah.
So it's basically, it acts as an antioxidant, really. And because if you look at like the nerve, it's like an electric cord with that outer layer. And then inside that outer layer covers the fibers. Yes. So when you have issues also with nerves like peripheral neuropathy, where you have that tingling sensation in your fingers or toes, it's the little sheath, the what we call the myelin sheath on the nerves that's degraded. It's no longer working. It's bare. So your nerve fibers are exposed, and then this vitamin will, help to
that condition, multiple sclerosis.
Yeah.
MS.
Yes.
As you mentioned, myelin sheathing around the nerve. Are there implications for helping that area also?
Yes, they are, because that particular disease is wherein the myelin sheath is exposed, like I was giving you the analogy of the electric wire, right. And this helps to rebuild that. So,
that's interesting.
Yes.
Wow. Sounds like a cure-all. I know you don't necessarily present this as a cure-all, right? The grand panacea.
Well, of course, no, not really. People have to, in order for us to be whole, we have to eat a holistic diet. There's not one vitamin or one mineral that we can subsist on. We need macro and micronutrients in our diet to survive. But as I will probably discuss in other presentations, the land is depleted. And so we must supplement certain things.
I'm getting anxious now, Mrs. Palmer.
Yes, sir.
What exactly is this vitamin?
So this vitamin is called vitamin K2.
Okay. How does it work?
It basically works by activating or mobilizing two key proteins in our body. One that's called osteocalcin, and the other is called MGP, which is matrix GLA protein. These proteins, their job is to mobilize calcium to get it to the place where it should be. So I give the analogy of you come in from shopping and you have your bags of grocery and you put them on the floor in your kitchen or on the countertop or wherever, and you leave them there. And you call your two kids, say, put these away, and they pack them away in the cupboards or in your pantry or wherever.
Yeah.
That's the job of osteocalcin, calcin, and MGP protein. It shuttles calcium to where it should be
Okay.
instead of depositing it in the soft tissue like your heart,
Interesting.
your brain, your kidney, these, your eyes, or wherever it is. Because if you find yourself taking calcium and vitamin D and you're not taking vitamin K2, you're in problem.
Well, many times there are some medical practitioners who would recommend vitamin D, but they don't give that additional information about the need to
That
have
is
something to do the shuttling, as it was you call
that
it.
is true,
Right.
but you will see
In
online.
that case, it can actually hurt you. An
Indeed,
excess of, yeah.
indeed, and I think it was about in 1975. They scientists at Harvard started pinpointing this. Well, this vitamin was, if I should give you a little history, was about, it has been discovered maybe about 70 years or more now.
Oh.
Since 1939, almost 100 years, 80, 90 years. But it was not very understood, right?
I see.
About in 1979 or 75, thereabout, scientists at Harvard started looking more into it in the sense that there was a strong correlation between atherosclerosis, cardiovascular disease, and this vitamin. They realized that this vitamin could take calcium out, and hence
Wow.
a study was done in 2007 that showed that most people are depleted in this vitamin, because although we make it in our intestinal tract, if we don't, our bacteria is not making enough.
Okay.
Right.
So it's not enough.
So we need to supplement. Right.
Interesting. Can you elaborate a little bit more about the history of who found it initially, and how did he come upon it, or she came upon it?
Well, certainly. This started, like I said, many years back in 1939 by a doctor, a dentist called Weston Price.
Okay.
So he moved from Canada, I believe, to Cleveland, Ohio, and set up his practice. But he was swamped by people with dental issues. And I guess at some point he got, what I did read was that he got tired of seeing so many people and started wondering what is causing this. And he found there was a link between modernization, the modern American diet, and dental cavities. So he and his wife set out on a worldwide trip to discover what gives health, because he recognized that the standard American diet was white flour, white rice, oils,
Sad diet.
right. And what he found by visiting people in remote areas of the world were that they had, although they didn't have good dental hygiene, had perfect teeth. So he started researching and came up with at least a couple fat soluble vitamin that was in their diet that he recognized, because they ate milk, drank milk and these things from grass-fed cows. This particular vitamin was a catalyst for getting the calcium where it should be, but he didn't know what it was at the time, so he called it factor X.
Okay.
It was later on that two other scientists, about a couple of years after him, got the Nobel Prize for isolating vitamin K, but that was K1.
Oh, I see.
So they thought, and maybe we should show that on the screen, that K1, it was called vitamin K, it was called K because one of the scientists was German, and he called that coagulation. So K in German starts with
Okay.
coagulation starts with K.
Mhm.
So these scientists
And
found
this is
out,
still vitamin K1.
well,
Or they're finding vitamin K2.
they haven't found vitamin K2 yet, because I'm speaking about vitamin K1. So vitamin K2 came later on, right? And this is the one that is the shuttle. It catalyzes these proteins.
More beneficial than K1.
Exactly. K1 we find abundantly in our vegetables and stuff, green leafy vegetables. So if a person is on Coumadin or warfarin or whatever blood
They
thinner,
discourage use of K1.
they discourage the use of K1, particularly green leafy vegetables, because that is converted to K1 by the bacteria in your intestines. But K2 came later on when scientists began to zone more into this activator factor. They found that K2, which Dr. Price had discovered years before, was beneficial. And hence why I'm speaking about it, because so many people have found it to be beneficial. If you have cavities, they found that this remineralizes the teeth. It takes kidney stones out of your kidneys because it mobilizes the matrix GLA protein and osteocalcin, which binds to calcium and shuttles them back to the bone where they should be.
So you're actually saying that if there is distribution of calcium or calcification of different soft tissues in your body, that this vitamin will actually find them and take them out?
Exactly.
Wow.
It's not that the vitamin finds them, but the vitamin is a catalyst, as I said before, for two major proteins. And the proteins, like your kids, in the analogy that I gave before, takes the calcium where it should be, packs it away in the bone to make you stronger. So it not only helps with cardiovascular disease, but I hasten to add osteoporosis as well. Because, as women, as we age, we cut down on estrogen, and estrogen is very instrumental, or estrogen as many people call it, is very instrumental in having strong bones. And so it's important, I cannot stress any further, that if we're taking vitamin D and vitamin K2 is important, along with calcium, if we're taking that. If we're taking vitamin D, it's important that we take K2. And you will see many manufacturers are putting K2 in with vitamin D, D3 in
That's
particular.
encouraging to hear.
Yeah, because it works synergistically. Vitamin D mobilizes calcium, but then calcium is sitting there not knowing where to go. So the body dumps it all over in the soft tissue. Here comes vitamin K and takes it to the bone. So you have clean arteries, clean kidneys.
I need to be taking some of that.
And then you have stronger bones. Wow. Right? So that's a basic history. And I know people might be asking, what's the dosage on it? Yeah. Right? Yeah. So
you had a slide here with the dosage?
Yes. The studies that have been done show that 100 micrograms is good to do on a daily basis, supplemented. However, it's recommended by many health practitioners that if you have cardiovascular disease or kidney issues or whatever it is, that you need to have that excess calcium taken out. But particularly cardiovascular disease, it's good to go up to 200 micrograms daily.
As much as 2.
Yeah.
Okay. Well, that's a mouthful. Mrs. Pollard. Where do we go from here?
Well, what I would suggest to our viewers, like I supplement with K2. Right? I try, and so I think everyone that is, like I said before, that's supplementing with vitamin D, and there's an epidemic, and people are taking vitamin D, especially during COVID. You need to be supplementing with K2.
So wouldn't there be some post-COVID fallout as a result of people overdosing on vitamin D without having this knowledge. Well, thank you so much for coming, and it was very, very informative. I
Thank
look
you.
forward to hear more about other areas of your concentration.
Okay. Thank you for having me. It's my
Right.
pleasure.
Right. So you hear it. Mr. Vitamin is vitamin K2. Okay. So until we meet again in this forum,